York with window shopping for you here on Life FM.
And it is a Wednesday night, a Wednesday fortnight, and it's time for one of these.
Wellness Wednesdays on the Takeover. Brought to you by station sponsor Kelli K Naturopath. Book your free discovery call today to uncover better health and quality of life.
Kelli K joins us in the studio live. Kelli, how are you?
I'm great, thank you. How are you?
Doing well, thank you. Did you happen to see Holly and I earlier our creation, our gastronomical creation of what was it? KFC and Krispy Kreme.
Yeah, pretty impressive, I reckon.
Yeah, no, I didn't, but well done.
Yeah. What do you think? Does it have a lot of nutritional value?
I think the joy that it brought you has the most value. Yeah,
that's very true. Yeah, it did bring us some joy,
serotonin, and all of that.
Right, that's right.
Yeah, just as important, right?
Just as important.
And the social connection that came with it.
That's it.
Yeah.
That's it.
Very important.
Definitely sometimes food. So great to have you here tonight, Kelli. We are chatting with you about something that I think is, it's maybe not spoken about very often, but chronic pain in young people particularly. Tell us, chronic pain, what is it?
Yeah, well, chronic pain is pain that's experienced daily for 3 months or longer. So it can be caused by a number of different things, and it's an interesting one because I think we often think of persistent pain or chronic pain as an old person's problem. But in actual fact, almost 70% of people who experience chronic pain are of working age, and that includes children, adolescents and young adults.
Yeah, wow.
That's a huge statistic, 70%.
Yeah, it is. And, in young people, I think it gets dismissed a lot.
Yeah.
So 1 in 5 people have experienced some sort of chronic pain. So it's a lot of the population.
Yeah, that's a lot of people.
It is. Yeah. So, in young people, I guess it can be, that musculoskeletal pain or from injuries and whatnot. Often when we talk about chronic pain, we think of, the old back pain or whatever. But actually I know what I see in clinic is a lot of some really conditions that are becoming quite common in young people. So things like endometriosis in young women and girls, and abdominal pain in IBS, a lot of fibromyalgia, so another pain disorder, and migraines. Migraines is a big one, and headaches, as well. So it presents differently for each person, and there are different types of pain, but living with pain is exhausting. It's hard work, and there's a big link with people who experience chronic pain and mental health issues like depression, anxiety. Can be a huge problem. Yeah,
because when you were mentioning a few of them just then, I know that I get headaches every now and then, and different people that I work with, younger people get headaches quite regularly, and it's quite a common thing for young people to get headaches and migraines. And I guess we didn't say we were going to discuss this, but if I can just ask you an off the cuff kind of question, Kelli,
sure.
Things like over the counter pain relief. Obviously, at the time, you just feel like you need to take something.
Yeah.
Is that long-term, can that be dangerous?
Well, I guess it depends what you're taking and how often.
Okay.
If you're finding that you're needing pain medication on a regular basis, so multiple times a week or even a fortnight, or even a month, really, I suppose.
Yeah.
But, then it does have negative consequences long term with most of the pain medication that's available. So they're often not good for your gut. A lot of the non-steroidal anti-inflammatories can inhibit sort of nutrient absorption as well.
Yeah, right.
So, and can be really not great for the lining of the stomach and intestine. So there are some long-term consequences ongoing. So it's about finding that balance and finding other strategies to be able to help you manage the pain so you're not so reliant on medications. And the other problem that, a lot of the pharmaceutical medications have is that your body adapts to things when you're taking them frequently. So they can become less effective over time, and that can be a real problem if you're in pain every day.
So,
it's not ideal. It's sometimes necessary, and sometimes you just need the relief, but it's about, I suppose, trying to explore other options that you can incorporate as well, so that you don't have to be quite so dependent on them.
And that's probably what we'll chat about a little bit after this next song. Stick around. We are talking about chronic pain for Wellness Wednesday.
Pink lemonade.
Probably a sometimes food, pink lemonade from Peabod, as we're in Wellness Wednesdays right now with Kelli K, Naturopath, joining us. Kelli, thank you so much for being here.
Thank you for having me.
And tonight we are looking at chronic pain, particularly in young people. It's not something that we necessarily think of affecting young people, but it's actually more common than we realise.
Definitely. For sure. Crazy. Speaking of our topic for tonight, which is chronic pain, I had a question, which was, does our diet impact chronic pain?
Yes, it definitely does. There are, I guess, three main reasons, or three main things that ways our diet impacts pain. And one is an inflammatory diet. So the typical Australian diet is high in foods that drive inflammation and low in foods that have that opposite anti-inflammatory effect. So it's really like adding fuel to the fire. So that's one way. The second way is nutritional deficiencies. So there are some nutritional deficiencies that have been linked with worsening pain or more severe pain or worse intensity. Things like vitamin D is one of those, and magnesium. Also vitamin C as well. So one of the first signs of mild vitamin C deficiency is sort of aching muscle pain in the legs. So, there's a few really common deficiencies that we need to make sure that we correct so that people have a better experience or are able to manage it better. And then the third thing is looking after our gut health, which is really dependent on what we eat. So really lots of fibre-rich foods, prebiotic foods, probiotic foods, and because that gut bacteria, which we've talked about before, I know, one of my favourite subjects, because I'm strange like that. But
that's fascinating.
Yeah, it is. I think so. That bacteria, if it's not in the right balance, or if there's infection, it has a big role in regulating inflammation and regulating the immune response. So particularly relevant for people who have pain associated with autoimmune conditions, or where there's abnormal inflammatory patterns like fibromyalgia and endometriosis, and obviously irritable bowel syndrome as well. That's going to be a big part of it. So I'd say they're the three key ways that our food diet impacts how we experience pain.
Yeah, right. And as Maz mentioned before, we were talking about like pain relief and the dangers of taking that. Are there different alternatives that we can use instead of that are more natural and can help people that are suffering with chronic pain?
Yeah, and I'd say, I'm cautious in saying instead of pain relief, but as an adjunct to support, whatever else you're doing pharmaceutically. But absolutely there are. So now we have quite a number of herbal medicines which we know have a really good anti-inflammatory effect, and also herbal medicines which support the nervous system. So the nervous system has a really important role in how we experience pain, because our brain is what creates the pain. It's an alarm system. So when that goes out of whack, our pain can be amplified or abnormal. A number of herbal medicines, so things like boswellia and turmeric and Jamaican dogwood, and there's a whole list that can be used in these circumstances. It is important, particularly if you are taking pharmaceuticals, that you talk to a naturopath or a nutritionist before you take anything, to make sure it's safe for you and to make sure it's the right fit for what you need as well. But then there's also things like really prioritising sleep. Obviously, it's really hard if you're in pain to sleep, and then the lack of sleep makes the pain worse, and it becomes this vicious cycle. So, getting some support around that and introducing relaxation techniques, mindfulness, deep breathing, those types of things become really important, not just to do every now and then, but to try and make a consistent habit of them.
Yeah. Even things like, I don't know, like essential oils, can they help with sleep as well? Things like that you can kind of apply.
Yep. So you can use sort of like herbals that will help. Things like magnesium can be really, it's got to be in the right form and the right dose, but that can be really helpful.
Okay.
And then, like lavender oil is a really good one that you can use. Things like hot showers, hot baths, magnesium oil can be, some people find helpful.
Yeah.
Avoiding screens before bed, that kind of thing.
All of that, like sleep hygiene.
Yeah. All that sleep hygiene. And it's about, trying to address all those different variables so that accumulatively you're getting a better overall response. Yeah.
Before we let you go, because I know you do need to head off, but just very quickly, you were saying that the Australian diet is very inflammatory traditionally.
Yes.
Why do you think that is? Why do we in Australia tend to eat more inflammatory foods? Like, is it just our history and culture?
Well, I say Australia, I'd say the Western world in general.
Yep.
Yeah. So really since the industrialisation of food, where we've everything's more processed, more convenience foods. We have more takeaways that are really, we can just zip through the drive-through.
Yeah.
So the changes in the different types of fats. So it's very high in the types of fats that create inflammatory compounds and lower in the types of fats that create anti-inflammatory compounds.
Yeah.
So, things like oily fish and nuts and seeds and fruits and vegetables and things. So I think a lot of it has to do with industrialisation, modernisation of our diet, us being too busy to cook, losing some of those cooking skills as well, and marketing.
Yep. Yeah.
Honestly,
sure.
like
convenience.
really, marketing convenience.
Yeah. Oh, wow. It's definitely food for thought. No pun intended. But it really is. Like, it's just there's so much to think about. But at the same time, it's actually quite simple if you just sort of stick to the,
the basics.
And eat well, get enough sleep, drink enough water. Like that helps. So thank you so much, Kelli. So much to explore, particularly in, I guess, the nutrition side of it, but in chronic health in general, so much more to discuss than what we've been able to touch on tonight.
I think it's good for people to know as well that there are other options that they can explore as a part of kind of a holistic approach. So, So
it's not a one-size-fits-all approach either.
And you can find, I do post a fair bit about pain on my Instagram and Facebook because it's an area that I have a special interest in, pain and fatigue. So if you want more information about how, diet and herbal medicines and things like that can support you, then go and explore that.
Kelli K Naturopath on Instagram and Facebook, and we've shared your link in our story tonight, 1079 Life on Insta, so go and check it out. But Kelli, thank you so much for joining us for another Wellness Wednesdays.
Thank you.
Always a lot of fun.